Out to the pandemic, a shot in arm acting as armor. Two new CDC studies show COVID vaccines remain highly effective during the Omicron surge. The studies released Friday show vaccines still protected well against hospitalization, ventilation, and death from COVID-19 infection. At Omicron's peak, data showed unvaccinated adults were 12 times more likely to be hospitalized than adults who had received both vaccinations and a booster. The CDC says the studies show the importance of staying up to date on COVID-19 vaccines, including a booster dose for those who are eligible. And if you would like to get a COVID-19 vaccine or booster, there are free clinics providing the shot to people ages 5 and up. Moderna and the J&J are vaccines available to adults, and Pfizer is available to those younger than 18. The next clinic is happening Monday at the Armstrong Youth Center in Bakersfield, and there will be a chance to go to the clinic at the Lamont Club in Lamont on Tuesday, too. Those clinics open at 4:30 in the afternoon until 7:30 at night. And the addresses, of course, are right there on your screen. And here's some good news about COVID-19 community levels, and projected deaths are down too. Now officials are talking about the transition out of the pandemic and the emergency phase. Amy Kiley reports on how officials are preparing for the future.
We want to make sure that people have an opportunity to relax their mitigation strategies when things are good, as they are right now.
Health officials are starting to talk about transitioning out of the COVID-19 emergency phase. Here are the numbers behind that good news. Less than 1% of people in the U.S. now live in areas with high community levels. So the CDC recommends few people need to wear a mask in indoor public spaces.
It's not too soon if you observe the caveat that's associated with that. And the caveat is we need to be flexible.
More good news is the CDC forecasts a decline in weekly COVID deaths.
Our hospitals are not full, but then that they should put that mask in a drawer.
A resurgence could come from an Omicron subvariant that spreads quickly.
I would not be surprised given the fact that we've begun to open up and we have an increase in the BA2 variant that we'll be seeing an increase in cases.
Experts say it might not be as deadly as other variants, especially if people are boosted. Moderna says it's asking the FDA to authorize another booster for emergency use for adults. Pfizer wants another one for those 65 and older. The final bit of good news is hope for the future.
This may very well become a seasonal disease where the amplitude of disease, the amount of disease that's out there gets less and less over time.
I'm Amy Kiley reporting.